Hi, everyone. It's Dr. Paul from the East Ontario Health Unit, once again with a weekly update. Today is June 15th, 2022. I'm going to start with, as usual, sharing my screen. I'm going to go over our local numbers first and give you a bit of a provincial picture as well. Good news in our area, we have nobody in the ICU, and we have only one admission for COVID, which is very good. And if we look at sort of our statistics and trajectories, you can see that we're really going down. This is even up here. This is for cases admitted that are positive, that are not necessarily for COVID. But if you look at COVID admissions, COVID-related admissions, we're down to 1. So again, good news on that front. The same goes for our outbreaks. You could see as well that we're on the way down. We're now back down to 3. Like I said a couple of weeks ago, it takes a week or 2 for them to clear. So we are going in the right direction in that regard. In terms of our percent positivity, again, we're now at 4.3%, which is excellent. I'd love to see it go down even more. I'm comfortable when it's lower than 4%. So that's excellent. Again, we still have 4% of people who test are positive, but it's much better than it was a month and a half or two months ago. And then finally, in terms of our wastewater, you can see that again, this is for Hawkesbury, we're flat here. This is for Cornwall, and again, it's flat as well. And then sort of Castleman is up and down, but it's much lower than it was. If we look at the provincial data, which I'm going to share with you right now, first of all, before I do that, I just want to show you sort of our case rate numbers. And you can see here, this is our case per 100,000. And you can see that we always get ups and downs, but the whole tendency is downwards. So again, this is good news for our area. In terms of some of the provincial data, I'm now going to show you some of the provincial trends that we get on our our dashboard, really. And you can see here that for cases, deaths, positivity, outbreaks, hospitalizations, and ICU admissions, everything is down. And this is provincially. We can also see as well sort of the trajectory and trends. We can see here in this slide here that most of the health units, again, are decreasing. We're kind of down here, so we're kind of low. You can see some slight increases in areas, but you can see on a downward trend. Ottawa has had a slight increase, but still, for the most part, it seems to be flat. Again, if you look at where we are, we're now at 21. We were over 100. Several 4 to 6 weeks ago. So again, that's a downward trend, and you could see downward trends across the province. Looking at positivity, we can also see, actually, this is, hold on, I'm just going to go here. Yeah, this is average weekly cases, and there's the positivity is also on the way down as well, where we have, here we go. So the positivity, again, there's a bit of an increase in Ottawa and Northwest. But again, we'll just keep an eye on that. We have nothing else is increasing in those areas. So, but again, for the most part, everybody is decreasing, including us, like I showed you before. And in terms of some of the other data that we have, again, this is what we're seeing now in terms of cases and hospitalizations. Everything's on the way down. So that's what we're seeing provincially, which is good news. And I just wanted to show you the wastewater here, where we do have again, for the most part, a decreasing trend. There are some areas with slightly increasing, but again, we will expect to have this up and down, up and down. We have to look at the global picture with everything else: positivity, hospitalizations, ICU admissions, and so on, which are on the way down. So that's something that we need to look at. I'm just going to now show you our local vaccination data. Basically, we're really stable in terms of a very slight increase of 4th dose and across the elderly age groups here. But again, 3rd and 4th dose is still stable. We need some work, particularly 3rd dose here. Again, I've said it time and time again, please get your 3rd dose in better protection against Omicron. But again, we have very high 1st and 2nd dose protection. And we do know that the vaccinations do protect, even if they don't prevent you from getting it. Vaccinations definitely prevent deaths, prevent hospitalizations, and prevent ICU admissions. So the bottom line right now is that we are on a downward trend. We are something that's we did expect, and so I do expect that the numbers will continue to be low. They won't be zero. There'll be some cases here and there throughout the summer. But however, I do believe that we still should be, weary about it. Although I think we will have a more normal summer. So moving forward, again, I would recommend that masking mandates have been removed by the government. They remain in long-term care and retirement homes. They also remain in hospitals and other clinical settings because we want to protect the vulnerable. So moving forward, really, the summer is going to be one where we're just going to enjoy a more normal summer, I believe. We'll keep an eye on the numbers, keep an eye on surveillance, keep an eye on new variants. Hopefully nothing will show up. And then preparing for the fall in terms of, do we need a fourth dose? Do we need a fifth dose? There's going to be a new Omicron. We're waiting for pediatric doses as well. And we're going to be preparing for the flu. So all in all, it is a good picture, but still, please bear in mind that it's not zero. It's still there. It's a low transmission. We're still in a worldwide pandemic, as you know. And so in terms of masking, if you're uncomfortable, if you have a risk if you're vulnerable and so on, you should be wearing masks. Consider wearing masks when you're indoor, crowded places, particularly if you don't know the vaccination status of people around you. So that should continue on and off, and we're going to be reassessing whether that will be an increased recommendation in the fall. But for now, like I said, continue the public health measures, masking as required, and if you haven't got your vaccination, it's never too late. We have vaccine clinics all over. We have MobiVax. We have a portable truck that goes around, an ambulance that goes around vaccinating. So again, thank you very much for all that you do. I think that we are going to continue these. I know that there's not much to report. It's a downward trend, which is good. So the less we have to report bad news, the better. And so again, once again, thank you, and I'll see you next week.